Hey, it's Jennifer, and today I want to talk about alternative movements you can do to keep working out even when you have disc-generated back pain. So disc-generated back pain just means that you're having back pain, and the reason you're having that is a disc between your vertebral bodies is probably pushing back a little bit into the nervous tissue in your back. So the discomfort you can have from this is definitely on a spectrum. So it can be totally debilitating to have a herniated disc, or you can just feel like, oh, I have like a little tweak in my back. So this advice is definitely for people who maybe had some more serious pain earlier and have rehabbed forward, but maybe aren't 100% yet, or people who are just having a little bit of discomfort, but like overall day-to-day things are going okay. Okay, so if you're having disky pain in your back, what's not going to be comfortable is rounding your back forward like this. So for example, the other day I was doing some fall yard cleanup and I was doing a lot of raking and bending, and later I was like, ooh, that does not feel good in my back. So I had to alter my workouts to find movements that still feel good. So some common movements that people have trouble with, biking. When you're biking, usually your back is a little bit rounded and that can feel really uncomfortable. So a swap for a bike ride would be walking, where when you're walking, your leg kind of extends behind you and gets your back into more of an extended position, which is a really comfortable position for people having discogenic back pain, or even running. If that impact feels okay, when your leg goes behind you, again, you're getting into an extended position with your spine. So those are your cardio swaps. And then if we're talking about lower body movements, a problematic movement is often a squat, because at the bottom you might get a little bit of rounding in that spine. So especially low squats might not feel good. A good swap for that would be a lunge, because with this leg going straight down instead of coming forward, the spine again stays more extended. So a lunge will feel much better than a squat. Finally, one of the most difficult movements for people who are experiencing discogenic back pain is like a deadlift. So either you've got, like a kettlebell, or you're doing a barbell and you are bent all the way to the ground and picking up the weight like this. That forward bend can be really challenging, with either pain at the spine or like causing some nerve tension and feeling that pain go down your legs. So a couple options for this. You can do a little mini RDL. So you'd hold your weights here. Nice bend in the knees, and then just hinge forward as far as you can without any discomfort. And you're really focusing on keeping your back nice and straight. So little mini RDLs, or if that's too much, a bridge is often much better tolerated. So you still get that hip hinging movement. So if you're having back pain caused by a disc, instead of biking, squatting, or deadlifting, you might try walking, running, lunging, and then doing mini RDLs or bridges. So hopefully that helps. Again, if you're having this kind of back pain, best thing is to consult a PT and make sure everything you're doing is A-okay. Thanks.